Today we'll follow up with Dr. Stuart Hart. He's from the University of South Florida's Center for Advanced Medical Learning and Simulation.
Ethan and I had a chance to receive a tour from this world-renowned, one-of-a-kind medical training facility and see some of the products that they are creating to advance medical procedures and training. We're here in Tampa with Dr. Stuart Hart, Medical Director of Tampa Bay Center for Research and Innovation Center at CAMLS in Tampa. So, Dr. Hart, why don't you explain to everyone watching what CAMLS is and what you do?
So CAMLS is a world-class medical facility for training all healthcare providers. We are the largest freestanding healthcare education training and simulation center in the country, and our goal is about training the next generation healthcare providers. How can we improve healthcare through training?
What I liked is your analogy that CAMLS is sort of the Taj Mahal of learning centers for medical students around the country. And it's 90,000 square feet, correct?
Correct.
And what sort of things are you, we have yet to be shown around here, so what sort of things are we going to check out today?
So we're going to start with the Surgical Interventional Training Center, which is 39 high-end surgical skill stations, where we can immerse learners in any type of operating room or procedural room environment. And so we have all the latest technology to train the next generation of healthcare providers.
The thing I found interesting was the fact that everything is so hands-on. It really sparks that creativity and innovation. And quite honestly, I personally can't wait to see the synthetic cadaver. That's one that impresses me. That and the 3D printer.
3D printer you have, and actually I know Kimberly was all excited about this. We're actually going to gown up and sort of have Dr. Hart run us through, I guess, a simulation, correct?
We're going to have you perform surgery today.
I can't wait.
So this is our anatomy table that we use to train medical students, nursing students, all the way up through physicians that have been practicing for many years. But it allows us in a 3D format to teach anatomy without having to go to a cadaver lab. Going to a cadaver lab is very expensive, it's time consuming. If a provider, a clinician, wants to learn about an area of anatomy that they may not be as familiar with, we can come up here and we can in 3 dimensions zoom in and out of that particular anatomy and teach them the relationships, because it's typically the relationships between anatomic structures that's so important, especially to a surgeon or to any type of provider that performs procedures. So this is the vascular system right here.
So I got to imagine in the long run, given what does a typical cadaver cost and how difficult are they to get? I was just going to say, because this has got to be an extremely expensive machine, but I would imagine over time, not having to pay for cadavers and things like that, it ends up paying for itself.
Right, and there's several issues with cadaver. There's cost, there's time associated with it, and there's availability of cadavers, and the appropriate cadavers that have the areas of interest that you're trying to teach. So we eliminate all this with technology. So we can come up to the center, come in this room, and really hone in on that area of anatomy that needs to be learned for that particular procedure or situation. How
much more can you kind of dissect, so to speak, on this table? Are you able to cut into what we're seeing here?
So let's go back to the full patient, and then we'll cut through, and then we'll show you how we do this. It's just like surgery.
Now, certainly it is going to differ from a cadaver from certain perspectives. Like, say you were going to try to do a surgical approach, certainly you can't tell by just touching the screen, correct? I mean, it's going to have some limitations.
Right. And so for procedural training, surgical training, you want a cadaver, you want other type of simulation tools. But to learn the anatomy, which is the basis for surgery.
So it's a good introductory tool.
Great introduction. So we'll walk through, so you can take a real patient, and we can cut through in any location. So you can go ahead and take your finger.
Which?
Doesn't matter.
Any place. You can even do diagonal.
Okay.
Now you gotta turn
Now you can rotate it. And now we can see from that angle what the anatomic structures were affected by your cut in that area. And then we can zoom in and out. Right, this is a surgical simulator that we built here at CAMLS. This feels and looks exactly like skin. This is our synthetic skin that we actually designed and built here. And this is a simulator that we built here. And within the simulators contain bowel. So today we're practicing bowel type surgery, and that's why we're putting you through these tasks currently.
Oh, I think I just heard him. It's a very strange feeling, you know, for someone who is clearly not used to it.
Right now, would you say with all the twisting and motions we're doing, this would cause an irritable bowel?
It could cause irritation. You could tear the bowel too. As you saw, grasping here, you actually ripped into the bowel. So it requires a certain degree of movement, and you have to grasp the bowel or the tissue in certain areas and very carefully. You don't want to tear into tissue because then you get bleeding and other damage.
I think you lost your bowel.
I think I did. I ruined my patient's bowel here.
It's out of the surgical visualization.
It's very, very cool though.
But the way, the movements of these, especially, they're hard to for me, to manipulate, but
It's just awkward and alien.
It does, it feels extremely awkward. Again, this is something that the doctors are going to be used to doing, so they're used to these motions, unlike us that are getting on these for the first time.
Right, surgeons spend years training to be able to perform these type of surgeries.
Correct. Now, the synthetic skin feels pretty real, but there was something you showed us on a table over there that was much more skin-like, and it actually had like a grain or texture of skin. Why don't you tell us a little bit about that?
So this is a silicone-based skin.
Okay.
So it can be used to train how to close incisions for laparoscopic and endoscopic type trainers. We use it a lot to build our simulators. But we also have a water-based tissue that really simulates lifelike skin. And so we use that for other types of simulators. And so we're building a simulator that will allow doctors to perform an entire hysterectomy. And so this is a manipulator that we use in surgery. And so we're going to have an abdomen over top. We're building it right now, so it's actually going to be a little bit wider. We'll have a full abdomen.
Okay.
And we can drape it just like we did back there, and we can perform full surgery. But so we're looking deep in the pelvis. And so we have the uterus, and we're able to manipulate the uterus. We have the ovaries and tubes. And so this will simulate a hysterectomy procedure. And we're using the manipulator to move the organs in the area that need to be moved so we can properly perform the procedure. But we can do this for any type of simulation. So we can do this in colorectal surgery or general surgery or urology. We can build these type of models, and we do here. So doctors are trained on realistic type simulators.
What sets this apart from models that are already on the market and exist? Why did you have to develop a whole brand new one here at CAMLS?
Many of the models on the market are plastic, and so they're not realistic. This is a synthetic material that is very realistic and lifelike. So this actually feels like a real uterus. This feels like an ovary. The ones currently are more plastic-based, and they don't feel like they're doing like they're really operating, but they're not doing an entire surgery. Typical models that are out there, you can do little parts of the surgery, but not the entire surgery. With this model, the surgeon is actually going to come in and do the entire procedure, just like they would in the operating room.
And you said this is still kind of under development. How long do you think before it'll be operational?
We'll have this done within probably a month or two. And we plan on using this in our teaching courses, so this will be used by gynecologic surgeons, hopefully from all over the world that will come here to train.